Hi, I'm Lacey Nobles with the City of Lubbock. Our news conference will start in just a few seconds. Hi, and welcome to the City of Lubbock COVID-19 news conference. We have a lot of information for you today from our panel. Today's panelists include Director of Public Health, Catherine Wells, Public Health Authority, Dr. Ron Cook, Lubbock Mayor Dan Pope. Our special guests today are Mark Thunderberg, the CEO of University Medical Center, and Walt Cathy, the CEO of Lubbock's Covenant Health System. Lubbock County Judge Curtis Parrish was supposed to be here with us today, but he is unable to attend. So let's start things off with Catherine Wells.
Good morning, everyone. I hope you all had a happy and restful Thanksgiving holiday. Last week when I spoke, I said that we were about to cross the threshold of 30,000 cases in Lubbock. Since then, we have reported an additional 3,045 new cases in our community in just 1 week. I also stated that we had exceeded 300 deaths, and now we are at 364. 64 people have died over the last week. And by comparison, when we look back at our data from July, we only had 2 deaths at that time for the entire month. Our thoughts and prayers go out to these families who have lost loved ones. Although our cases have not subsided, we do continue to see positive news around therapeutics and vaccines. Last week, Dr. Cook talked about some of the new antibody therapies that are now available, and we now have almost 100 Lubbock residents that have received these treatments. We're also hearing about more about the vaccine. There are at least 2 vaccines that will hopefully be approved this month. And remember, initial doses of these vaccines are going to go to our frontline healthcare workers because we want to keep them working, and also those living in congregate settings such as our nursing homes. We are still months away from having a vaccine available to the general public. In some other exciting news, today it was announced that CDC, the Centers for Disease Control, is planning to update our quarantine guidelines. We expect these changes to become official by the end of this week. And remember, quarantine is what we do if we are exposed to COVID-19. There have been no changes to what to do if you test positive. Once the guidelines from CDC become official, the health department will update our information, the information we're providing to the public, and also work to inform all of our community providers. How we expect these guidelines to change is we're going to start seeing two different ways to look at who needs to be under quarantine or when you can be released from quarantine. The first one is a test-based strategy. So this means that if you've been exposed, so you have a high-risk exposure, such as I was in my office, I wasn't wearing a mask, a coworker came in, and we met in my office for about 30 minutes or so, that would be considered a high-risk exposure. The one option you have is to get tested, either with a viral or an antigen test, 5 to 7 days after exposure. If you test negative and you don't have any symptoms of quarantine, you can end your quarantine on day 7 instead of day 14. So this cuts that time that you have to stay isolated in half. The other option is a no test strategy. So if you don't have any symptoms and you had that high risk exposure, you can be released from quarantine after 10 days. With both of these options, it's important for people to continue monitoring symptoms because you can develop COVID-19 at day 10, 11, 12. I've even seen people at day 13 or 14. So it's so important that we continue to monitor during those quarantine times. And with those updates, I will go ahead and pass things over to Dr. Cook. Thank you.
Thank you, Catherine. So things you're going to hear today, 2 things. We're not out of the woods yet. We've still got a lot of things to do. We still got a lot of safe practices to continue, and our hospitals are full. And then we also have good news. So those are the 2 things that you're going to hear today. Our hospitals are full. Just even last night, we had 19 patients that didn't have a bed. that needed a bed in the hospital. They were being roomed or housed in the emergency room. And I do expect an increase here in another week or so, a few days after that, in our COVID numbers related to, unfortunately, our Thanksgiving gatherings. However, we do have good news on the forefront. Catherine started to mention these. The vaccine is on its way. This is fantastic news. Europe gave its approval yesterday with the Pfizer vaccine. The FDA, the Federal Drug Administration, will meet next Thursday, so a week from tomorrow, to determine whether or not they'll release the Pfizer and Moderna vaccines for emergency use authorization. So after that approval, if it's approved on next Thursday, about 48 hours, we should be receiving doses of these vaccines. We don't know how much we will get because it has to be spread out over the entire United States. But I know that Texas will get some, and I know that Lubbock will get some. We just don't know how many doses we'll get. And as Catherine said, those will go to frontline workers first. The good news is that it's also 90 to 94 or 95% effective in creating immunity against this virus. It's a safe drug. I've already seen the emails from different people saying that it merges with your DNA and creates all kinds of problems. That is absolutely not true. It's an untruth. This vaccine does not merge with your DNA. Our DNA is housed within the nucleus of our cells, and it cannot get into the nucleus of our cells. This is an untruth. It is a safe drug. It is going to cause reactions like typical flu shot or tetanus shot or some of our other vaccines. You're going to have some soreness in your arm. You're going to have some muscle aches and pains, but that's the immune system doing its job, building antibodies against the virus. So with the Pfizer vaccine, it's going to take 2 injections, one on day 0 and then one about 4 weeks later to continue to boost our immune system. So our peak immune system response will be 2 to 3 weeks after that. So about 6 weeks to 7 weeks, you're going to have full immunity to the virus. What this means is we cannot stop what we're doing. We can't stop not wearing our mask and washing our hands and keeping socially distanced. The other thing here that I want you to hear is it's going to take about 80% of our population being vaccinated to getting to herd immunity. And remember, herd immunity happens when you have a herd. We'll call all of us Lubbockites in the herd, and we have 70 to 80% of us have immunity to the virus. Now, an individual who's infected, who never got the vaccine, comes into our group, our herd, and what happens is if 70 to 80% of those people are immune, this person cannot transmit it to anybody else, those 20 to 30% that don't have immunity. They might pass it on to one person, but then it stops because they're surrounded by 70 to 80% of people that don't get it. So the virus can't propagate. It can't continue to spread. That's the whole purpose of getting vaccines, is so we stop the spread of the virus. So let me encourage you. It's a safe drug. It doesn't mess with your DNA. We're not going to create COVID zombies. It's a very good drug, and please, we need everybody to get the vaccine. The other good news that the hospitals will talk about is our infusion centers. As the governor gave us, bamlanivimab and Regeneron, these 2 antibody cocktail drugs that help fight off the infection when you're infected. So there are criteria that you must meet. You must be infected, and you must be high risk to be hospitalized if your condition declines and you have to be hospitalized. These antibody drugs help stop that process. So age greater than 55 or 65, uncontrolled diabetes, uncontrolled hypertension, you must have an immune suppression disease, either from an immune disease or from chemotherapeutic agents for cancer. chronic kidney disease, and a body mass index of 35. And so a body mass index on somebody like me, I'm 5'11" to 6 foot tall, not quite 6 feet, unfortunately. So I would weigh 250 to 270 pounds. So obesity. Those are the high risk criteria that you might meet should you do so. If you fall into that category, make sure that you talk to your primary care doctor, your primary care provider, to make sure that you are eligible for referral. So we're not out of the woods, but we have good news coming. There's a light at the end of the tunnel. No, it's not another train. We have good news, and it's going to take months for us to get these vaccinations out. So until then, we must remain diligent. This is an ultra marathon. You must continue to wear your mask. You must socially distance in groups of less than 10 and continue to wash your hands. Nothing shows that you care for others more except by wearing a mask and social distancing. Blessings, friends. Let me introduce Mr. Mark Thunderberg. He's the president and CEO of UMC Health Systems. Mr. Thunderberg?
Yes, good morning. So thank you very much for the opportunity to speak with you this morning. I want to give you just a brief update on how things are going here at the University Medical Center Health System. I'll go through just a couple of different metrics for you. As far as capacity, we are at maximum capacity at present. Of almost 50% of our available beds are dedicated to COVID, about 48%. Each day we look at a particular metric that Dr. Cook mentioned that we started a few weeks ago, open beds and EC patients waiting for beds. So as of this morning, we have 12 open beds, but we have 16 waiting. So there's a bit of a negative there. And you see that sometimes on the website in the evening. So this puts a great deal of pressure and puts a picture to how tight capacity is at the hospital. As far as staffing, we have about 126 staff that we have been supplied by the state, and we're very grateful for that. Registered nurses, respiratory therapists, medical doctors. Texas Tech has done a wonderful job in bringing in some locum healthcare providers as well. So we're very, very grateful for each of those individuals. As far as staff that are out ill or quarantined, since March, there's been about 1,300 of those individuals. Right now, it's about 170 that are out. That's a little bit less than what it has been, but we're praying and anxious for them to come back to us safe and sound. As far as our medical units, our tents, we have 2 of those just west area of the campus, and those are primarily being used for patients that are waiting for placement in some other place, such as a long-term care facility or something like that. So those are saving beds or rescuing beds in the hospital, and we're grateful for those 2 tents as well. Testing continues at a very expansive rate in the clinics. About 88,000 tests so far in the clinics and about 19,000 COVID tests in-house. So that continues to grow and expand both day and evening. As far as the infusion treatment, Dr. Cook spoke of the monoclonal antibody treatment. And of course, the purpose is, of course, to keep patients out of the hospital, COVID positive patients. We did set up, if you're on the east side of the hospital, you might see it. We set up the Ambus clinic in about 4 days. I'm very grateful to EMS for helping with that. That opened last Monday on November 23rd. We have infused 80 of the original 82 doses that we received. As we prepared for this meeting this morning, we just a few moments ago were told that we did receive a new supply, as we were predicted to have. So we're grateful for that, and more is on the way. Patients are coming to this Ambus infusion center from primary care providers as they are searching for those that meet the criteria. And it's important to note the criteria was agreed to by Covenant and UMC as far as our medical staff leadership and our pharmacists together. Some good news, some of the anecdotal information we can share with you that we just learned this morning. of the patients that were infused last week for the several days we were open. Thus far, roughly about 30% have had no symptoms at all. Another 30% have vocalized some slight improvement. And then the last, about 25% have indicated they have felt what they have said is dramatically better. And so we're very pleased to hear that as well. And we'll continue to measure that as the days go by. As far as the vaccine that was spoken of just a few moments ago, we are preparing for a December 14th start date as far as when we'll open up our first vaccine clinic here in the hospital for frontline care providers. And then we'll have other dates set up and locations as well. The last thing I want to speak of just real quickly, and this really hits upon what Dr. Cook said, the thing that we are, I think, outside of just the logistics of running the organization, the thing that I think is top concern to us, more and more so seems every week, is the well-being of our staff. We certainly think and act and pray for them regularly, especially those at the front line. I want to just close with this because this is really what's on our heart and mind about our staff. The fact that our employees and the providers are resilient does not diminish one bit the fact that they are weary, well beyond tired. They're skillful, but they're very weary. And it's important to note, I think, as Dr. Cook was mentioning, we are really, this is nothing short of a fight, a war that we are in until this thing is completed. And when I'm in the community, I do see some compliance with wearing a mask, but I do also see substantial lack of compliance and what our staff might judge as a lack of concern. That may not be the intent, but that's the way it comes off. And so on behalf of our healthcare workers, whether they be here or Covenant or wherever they are in the community, I do ask for a visual show of concern. I ask for vigilance. I ask for action, however and whenever you can deliver it. The curve is not going to bend by itself, and the curve is not going to bend by antibody therapy alone. So I encourage you, I ask you wholeheartedly on behalf of our staff to help us in this fight. And with that being said, I appreciate your time this morning. I'll turn it over to Walt Cathy, CEO of Covenant. Thank you.
Yes, thank you, Mr. Thunderberg. On behalf of Covenant Health System, I just kind of want to go over some stats as well. We have 176 current COVID cases inside of our hospital at Covenant Medical Center. That is just shy, 2% shy of being 50% occupied by COVID cases. We as well have a negative bed situation inside of our hospital. We're actually at -2 as of today. We have about 16 cases currently waiting inside of our emergency departments to actually get beds. So we are still in this bed crisis situation as we are still working through that from a health system standpoint and from a community standpoint as well. The things I kind of wanted to highlight today is our AMU system that we have. We have built that specifically to help us with outpatient infusions. The goal for us is and always will be, how do we decrease the number of patients that actually need to have a bed while fighting COVID? And so with us doing the antibody therapies, with us doing some of the Regeneron, those type of things that we're able to do in this infusion center, we believe that we can see about a 20% reduction on bed utilization while fighting the COVID virus. And so we're asking for people to get to their PCP. We're asking for the PCPs in the community to really put forward admissions into these AMUs so that way we can get the infusions going inside of our community, because it's another battleground that we can use instead of it just coming to the main hospitals, whether it be UMC or Covenant. I would also like to reiterate what Mr. Thunderberg said in regards to staff. Our staff have now been fighting this for over 8 months. This is not a typical, emergency operations center endeavor where we just found a situation that we're dealing with something in a very short term. This is a very long-term virus that we are facing, and the staff are very weary. We've had a lot of communication within our staff pool here and talking about their feelings in fighting this. And I don't believe the community as a whole really understands the impact it's having on our caregivers. Our caregivers are resilient, yes, but our caregivers is also built around a medical system that has created success for them. Success in being able to see patients go home. When we're fighting COVID, that's not this case right now. And we really kind of have to take in concern with that, because that is weighing on them emotionally just as much as anything else. They're not seeing the same returns in success and getting people back to their normal lives as they are in fighting the COVID situation. So I really implore everybody, follow the safety guidelines. Make sure you're wearing your mask. Make sure you're social distancing. Make sure you're not in groups more than 10 people. This will help us all as we continue to fight this battle, because I do think it is going to continue for a little while until we can get to the vaccine and we can get to really a herd immunity status within our community. And that's going to take several more months for us to get there. So I think we all have to be diligent as we are going into the holiday months. We all want to see our family. We all want to see our loved ones and our friends. But we also don't want to be the responsible party for getting our loved ones ill. Nobody wants that burden on them. That is an ungodly burden that nobody wants to face. So I, as well, am just imploring everybody, keep up the fight, because that's what we're in. And it's now my pleasure to turn it over to Judge Parrish to talk.
Thank you, Mr. Cathy, and thank you, Mr. Thunderberg, for being on the front lines of this COVID disaster, best way to describe it. A few weeks ago, I was on this the town hall meeting and described a probate hearing that I had been through with a person who had come in to probate his father's estate. And he had mentioned that his father didn't die of COVID, but his father was a victim of COVID just the same. And I'm also here today to tell you that I, too, am a victim of COVID. 2 weeks ago tomorrow, I tested positive for COVID-19. I wasn't showing any signs or symptoms, and I had not had any contact with anybody that I had known that was COVID. I was tested as a part of a group that was meeting with Governor Greg Abbott, and it just so happened that I came up positive without any symptoms, without any signs, and tested positive. I went home, began the quarantine period. It wasn't until a couple of days later that I started showing those signs and symptoms. They were very mild and to somewhat moderate, a lot of sinus congestion, some coughing. I have lost my sense of smell and taste as well. Those what we're calling classic symptoms of COVID-19. And so while we're hearing a lot about statistics, about hospitalization, about morgue surge capacity, I want you to know that this is not statistics to me. My wife and I are positive COVID. And because of that, we've had to adjust quite a bit of how we do our own life. We lost what we call one of the most important holidays. We lost Thanksgiving with our family. We spent that alone here at the house. But our story is just pales in comparison to the stories that I hear now, that I'm hearing throughout our community, of folks that are not just losing time with their family because of the isolation of COVID, whether they have it or whether their loved one does. But we're also more and more every day, we're losing our community. Our people of our community are dying at a very rapid rate. So as we talk about hospitalizations, and it's very important that we make sure that our hospitalization rate finds a way to get lower. As we talk about our healthcare workers who are testing positive because they are literally on the front line of this awful virus. We do know that our citizens here in Lubbock County are dying at a horrible rate right now. And if that is not heartening to you at all, maybe we need to have another conversation because this is really while anybody who catches this virus seems to have a lot of different types of reaction to it, there are some common reactions. But I will say for the older, for the most vulnerable, this is really affecting. And our old ones are dying at a very alarming rate right now. My mother, who is in a nursing home, also contracted COVID from an employee of the nursing home. She, like myself, was able to endure the COVID without any very serious side effects, any serious symptoms. But she's fortunate. Many of her neighbors, many of her friends have succumbed to COVID. And this is a time of the holiday season where we're thinking about gathering together. Thanksgiving, Christmas. This is the time when families gather. And we're not going to be able to do that this year. And so let me please encourage you. I don't know where or how I caught COVID or where it came from. We were using all of our precautions. Who knows how Brenda and I contracted this. But we do know this, that we are fortunate with good medical care here in Lubbock, that the symptoms were not as severe for us. But that's not the case for our neighbors. And so let me implore you, all of you, please take care of yourself. And you take care of yourself first by just doing those simple things. And when I call them simple, I know that it seems simple, but it does come with the sacrifice. It means that you're not going to be around your family and friends like you're used to doing. It means that you are not going to be able to enjoy the things that the traditions and some of those things that you have been able to enjoy before. I understand and I get it. But it's how you keep yourself safe. You don't know how this virus is going to affect you. And you really don't know how this virus is going to affect your loved one. And so if you have a loved one, even if you have a neighbor in your community that you care about, please keep them safe. I can't imagine if I were positive, not knowing it, spreading that to people that I love and they get sick to a point where they have to go to the hospital. I don't know how I could react to that. But I do know this, that we continue to pray. We continue to lean on our medical experts. We continue to do those simple things that we can do to keep ourselves safe, keep our neighbors safe, keep our healthcare workers safe. And folks, I do believe this. The people in Lubbock County, we are strong. We are strong, resilient people. We will stand up and we will beat this, but we cannot do it alone. We must do it together. So for that, I'm truly grateful. Mayor, I want to turn it back over to you and just say thank you for the opportunity to speak again. We will continue to do those things that we can do as a government to continue to get the word out that we need to do all this together. I don't want to see things that have happened for the decisions that county judges have made in other counties in our state. But the only way that we can not let that happen is that we must voluntarily do this together. We must lower this curve. And the only way we do that is that we do it together. Thank you.
Thank you, Judge. We're certainly pleased that Brenda and you both are doing better. I want to start today by sharing my screen and just sharing the data that data slides you're used to seeing from me. Positivity rate remains above 25%. I think once we had a little bit of a blip during the holiday where we were still getting results, but not testing. I think this line will flatten back out, and you'll see it much more in the 25% range, which is still way too high. Hospitalized patients, it's come down a little bit after setting a new high over the weekend. You've heard Mr. Thunderberg and Mr. Cathy talk about that. All of our efforts are to take pressure off the hospitals. The good news here that the cases, and you'll see the new positives in a moment, but the new positives in our 6 to 17 age range has come down, and we're gaining. We have fewer active cases than we had. Sort of the other side of the coin to that is that we've seen an acceleration in the 18 to 25-year-old range. And here is that case count by age grouping for the last 14 days. And you can see what I'm talking about. Once again, that 7, 8 year group, 18 to 25, still is the largest number of positive, new positive cases. This is the slide that I think sums up what Mr. Thunderberg and Mr. Cathy talked about, and that shows the fact that we've got actually negative hospital beds available and have for the last 4 days whether it's in the morning or in the evening. That means we're holding patients in the emergency department instead of in hospital rooms. This is what we're working every day to avoid. So I want to start by thanking not only Dr. Cook and Ms. Wells for their effort, but really thanking Mr. Thunderberg and Mr. Cathy. They represent about 11,000 caregivers in our community and in this region that work for Covenant and UMC. And your points that you both made about the spirit of your people and how they're beat down and how difficult this has been, those comments are not lost on me. And it is important that we do all we can to take some pressure off of our hospitals. Now, I've had a couple questions in the last 48 hours about contact tracing. And one of the questions was, I guess you have quit doing that. And the answer is no. We continue to contact trace. In fact, the state is even helping us a little bit with that. It's more complex because of the number of cases and because the degree of community spread. But that tracing does pay off. In fact, Monday of this week, we had a couple convenience stores close on their own after we worked with them to professionally clean, because they had employees working that were symptomatic and waiting for test results. So time out. Okay, we're 8 months into this. We've got to understand this better. If you're symptomatic, please go get tested. You don't have to get out of your car. You can drive. It's a drive-through process. It's very safe. It's very easy. But don't go back to work. Once you become symptomatic, or once you've tested as you're asymptomatic, if you've had a close exposure, don't go back to work until you get your test. Now, if you're asymptomatic and you get a negative test and you know you've had a close exposure, we want you to be careful. You may, several days later, start to show symptoms. In that case, you need to be tested again. Okay? Use your head. Common sense is critical in this process. Employers, I hear from you. Thank you. Thanks for taking the lead. But if you see an employee that's not just right, we can't work at 75 or 80% of our capacity. So many of us are proud about gutting it out. That doesn't work. We need to stay home. Face coverings. Thank you to Texas Tech and your leadership. I attended a couple of basketball games over the holiday, and the compliance was remarkable. Tech's done a nice job at reminding people with their folks that work in the arena They're taking the lead. We're going to see that in our with our school districts doing the very same thing with their basketball games. It's back to the point that the judge made and what we heard from other speakers today. We've got to cover our face. We've got to slow the spread of this. Now, we've not seen the peak, in my opinion. I do believe that the therapeutics and what we're seeing with those antibody infusions, that will keep people out of the hospital. If we'll do that, if we will follow our safety protocols, we'll start to see this go the right direction. It is good news to know that within the next 2 weeks, we will be vaccinating people with what is a safe and effective vaccine. Safe and effective. That's what we need to remind people of. I went to the funeral yesterday of a good friend. He died a week ago Monday. Only 15 days before that, I'd seen him on the golf course. He played in a group right behind me. He was too young to die. I have 2 final requests. If you go to work or if you've got to go out, please cover your face and avoid groups. Second, my encouragement is to stay home, to shop local, have your food delivered, to be careful, to go about it differently, and to continue to be hopeful. Lacey, back to you.
Thank you, Mayor. We're now going to open it up for media questions. I'd like all the panelists to start their video, please. Today's order of questions is Latino Lubbock, Avalanche Journal, Fox 34, El Editor, KLBK, KCBD, The Daily Toreador, KMAC, and Texas Tech Public Media. So let's start the questions with Christy Martinez Garcia from Latino Lubbock.
Hey, Christy, before you start, I understand happy birthday wishes are in order today. So
Thank you.
on behalf of the entire panel, we wish you a happy birthday.
Well, my gift would be that we find a cure and that everybody gets vaccinated soon. But
Hear, hear.
Dr. Cook, I'd like to ask my first question to you. Today, there was a release about, we're talking about the vaccinations and frontline workers getting the first vaccines, but the Nurses Association, the National Nurses Association, released a survey results where more than 40% of nurses are not willing to take the vaccine. So, and then we've had issues in regards to people not wanting to get tested. And we've had issues of people, the list goes on. And, more than half of Americans are still concerned about getting this treatment. So my question is, how do you really feel we're going to be able to achieve 80% of getting people vaccinated so that we can get to that as you say, the herd community, when we can't even get them to believe that this is a legit treatment?
Thanks, Christy, for that question. We just have to trust science. When I get on an airplane, I trust the pilot to do a good job, that he's certified, that he gets checked off, that he's regularly evaluated to be a pilot on a plane that I get on. There's a reason why I'm not a pilot. You don't want me flying your plane. I'm not a certified pilot. I could give my opinion, but in reality, my opinion doesn't matter about how to fly the plane. As a scientist, my opinion matters. I've spent 18 years after high school learning my art. And so we have to trust the scientists that are producing these drugs and used evidence-based medicine, not somebody posting something on Facebook or Twitter or any of these other social medias. Go to the source and trust and use good sources for your information. And that's what we have. That's the purpose of the Federal Drug Administration. Those are the reasons why. So far, we have seen nothing but good evidence from the information that they've given us from the CDC and from the FDA saying that these are good drugs. In science, if you ask a geneticist or a scientist in the field of using messenger RNA to create these vaccines, it's not going to create a COVID zombie. That's absolute nonsense. Absolute nonsense.
Thank you. My next question is for Mark Thunderberg. And this is on your plea of asking the public and on behalf of the staff to help in this fight. Do you believe that part of the problem of this fight is because of our state governor, as well as even our local government that has followed the lead of the state governor of not mandating face masks, of not being more conscious of closings, because that seems to be where it is all stemming from, is people aren't wearing masks. You said it yourself. Even the mayor commented on the fact that people are not wearing their masks, but yet it's not mandated. So, talk a little bit more about that, because I believe that there's an issue here.
Okay, thank you very much, Christy. I appreciate the question. Yeah, I'll say a couple of things. Number one, I believe my tenacity about this question has probably changed over the last few weeks and months. At the beginning, when we didn't have quite the surge we're having now, April, May, June, then things slowed down a little bit in the summer. And now past school opening, when we do see the rapid nature of this virus taking hold of our staff far more than it did months ago, then I am a huge, strong proponent of even the science behind the mask. And I want it to be worn, and I want it to be worn vigorously. I also know the issue of being in charge and trying to make the right decision for the entire encompassing issue that you have, or the responsibility that you have. So at this point, yes, I am encouraged by the fact that people, I think, will wear the mask if we are, how shall I say it, if we are encouraging them strongly to do that. Now, if that's possible to do that by way of some type of mandate or some type of more accountable measure, then I'm all in favor of that. I don't know where that would come from necessarily, the state, the county, the city, whatever that would be. But because the trend is not going to turn anytime soon, with or without antibody treatment, and it's going to be months before the actual vaccine is here for the long term, for the large populace, I am believing now that a vigorous mask effort, accountability is needed, if that answers your question.
Mark, and you and I know, I think your background is also public relations, and you and I know the difference between proactive and reactive. And do you believe that our government has been reactive and to put all of our eggs into this vaccine that isn't even here yet?
Well, the vaccine, of course, I'm hugely encouraged, and I'm taking the vaccine when it gets here. As soon as I can, I'm taking it because I'm weary of this as well, and I want to have an end to this. And that does give us, finally, gratefully, an insight, I believe, to the vast largeness of this disaster, as Judge Parrish called it. I'm not going to be in the business of really criticizing at this point. I want a mask worn. I want whatever it takes to get people to do it. Because I know as the state gets a little more inflamed with COVID, the availability of staff to come here from the rest of the state may not be quite as liberal. And therefore, the 126 people I'm counting on to be here from other locales, whether it be Oklahoma, Arkansas, Texas, whatever, if they cannot get here, then I'm going to look back on that and say, I should have worn the mask. More people should have worn the mask. There should have been more effort around that. So I'm seeing several months of us suffering through this. And I cannot help but be responsible for the health of my staff and therefore, what their impact is on the patients. So that's a long answer to, yes, we need to wear a mask, whatever it takes to get people to do that.
Thank you, everybody. And I'm glad you're better, Judge Parrish.
Thank you, Christy. Now we move to Matt Dotre with the Avalanche Journal.
Thank you, Lacey. I guess following up on the mask discussion, I want to ask the mayor, my understanding is that the tool in the toolbox, that's, to quote the governor, that cities can use is that you can require businesses to enforce masks. And I think back in June, you opted not to do that despite recommendations from the task force and health experts. Has there been any discussion about circling back on that and requiring that businesses enforce masks for employees and visitors?
Yeah, so thanks for your question, Matt. Let's talk about, first of all, we are enforcing the governor's order to the letter of the law today. There have been a few communities around the state that have shifted the responsibility for compliance to businesses. Our council has not taken that action. We talked about this at a special meeting a week ago Monday. It's likely we will talk about this again at our meeting on the 15th of December. I do not support making businesses the police force for masks. Now, a business owner has every right to refuse entry to someone who chooses not to wear a face covering. It's the no shoes, no shirt, no service type situation. And we certainly would support that. And if a business owner needs help enforcing that, we would be glad to do that. But I don't expect that that's something that we will be doing.
Okay. So, okay. And Judge, I want to ask you as well, I get a lot of questions about kind of what the county's doing, whether or not the county's enforcing any restrictions, if the county is looking at gatherings. Can you just kind of talk about some of the enforcement that the county's doing?
Well, Matt, the enforcement that the county is doing is strictly, as the mayor pointed out, what is contained within the executive orders of the governor. We are not going above what the governor has put in his executive order. We do not feel like, as a county, we have the authority to do that. If you look at some of the other counties, some of the other county judges around the state, specifically El Paso, that have put together measures that are above what the governor has ordered, courts have automatically, almost without question, shut any of those down. There are some things that the city can do with its home rule power that it can do within its jurisdiction. And Lubbock County fully supports the cities and what they do. However, as for the county, our only enforcement is what's given to us by the governor through the executive order. And at this point, the governor has not given power to local authorities, including the sheriff's department, including even police departments, to enforce anything. And when we say enforce, we can encourage, we can post Lubbock safe rules, and we can ask people, please. And of course, as what the mayor has pointed out, even businesses have the opportunity and the power to do what they need to do in their businesses. And of course, if a county business has an issue with a patron who's not abiding by their rules, certainly Lubbock County would be involved in that. However, in order to enact anything into the point of, I would say, compliance that legal compliance to any of these mask orders or gathering orders, we would need further direction from the governor's office.
So I guess you're saying the county has no ability to enforce anything.
Well, in the governor's order specifically, it says that there will not be any, you cannot detain somebody who's in violation of the executive order. Now, a detaining can also mean even writing out a ticket, holding somebody and say, because you have violated this order, here's your ticket. We have, in effect, detained them, which the governor says that we cannot do. So without further guidance from Austin, the only thing we can do is to continue to do what we are doing, encouraging, reminding people, yes, there is a mask order, there is a gathering order, but compliance to that must be and should be at this point voluntarily until such time as the governor issues another executive order.
Okay, thank you.
Or also, and I'll say this too, Matt, I do know that beginning next month in January, the Texas legislature will be meeting, the House and the Senate will meet. I fully expect that we're going to see some pretty serious legislation come through that session. So we will be watching and monitoring what the House and the Senate will be doing starting in January. I don't know. I think what we'll see is probably them giving a little bit more local control. I would like very much to be able to, for us at the county and the city level here in Lubbock County, to be able to respond to and handle situations here locally, rather than depend on Austin, who's trying to do a kind of a one size fits all, because what's good for Dallas County, what's good for Harris County is not necessarily good for Lubbock County. And so I think and I'm hopeful that the legislature has recognized that and will be able to enact some legislation to give us a little bit of help around here.
Absolutely. Very good. Thanks, Judge.
Thank you, Matt. Now we have Fox 34, Brittany Michelson.
Thank you. My question is for Mr. Kathy. So normally this time of year, it's getting colder. Around this time, do we usually see a spike in hospitalizations for other illnesses? Are we seeing that this year? And how is that going to complicate the COVID-19 surge even further?
I think that's a great question, Brittany. You're absolutely right. This time of year, we usually see a spike in patients coming into our hospitals for flu, for pneumonia, those type of illnesses. However, we're battling that on top of COVID. And I think that's really what is putting the burden underneath the hospitals right now on bed capacity. And so it's really fighting the normal things that we deal with on a year-by-year basis, plus this added virus now panel that we have to deal with. And the unfortunate thing is when we're fighting COVID, unlike the flu or pneumonia or anything else like that, the resources are so much more extensive that we're having to use in treating our patient population. The patient to nurse ratio is so much more one-on-one, one-on-two versus dealing with a patient that's, fighting flu or pneumonia. And we're stretching on those resources. We're stretching and we're putting all that burden onto our staff to figure out how we're going to deal with this influx that normally does happen, but deal with the complexities of COVID and the limited resources that there might be. And I think that's really what's creating the burden on the hospitals right now in our community.
All right, thank you. And then for Judge Parrish, so there's a Twitter account called covid-net, and they're pulling data, they say, from the New York Times and local and state agencies. And right now it's currently ranking Lubbock County for one of the worst positive cases per capita in the entire country. Would you say that that's an accurate representation, and should that be alarming for citizens?
Well, and quite honestly, I'm not as alarmed by the positive cases. I think what we're seeing is in positive cases, we're seeing multiple folks who test positive multiple times. So it's not necessarily what I look to is the number of cases. I think the things that we are mostly concerned with here is first our hospitalization rate. We are a medical community, and because we are a medical community, we see folks from literally all over West Texas, Eastern New Mexico, who come to Lubbock for their medical care. And I'm very proud of that fact. It is part of our identity here in Lubbock County is that we are a medical care community. And so when we see our hospitalization rates rise, that is what's probably a lot more concerning to me more than the positivity rate. When I also see our death rate rising, that has more of an impact to me. And those are the numbers that we need to make sure that we are getting absolutely under control, is our hospitalization rate and our death rate. That is absolute. We can count those. We know those numbers. As far as a positive rate, you know, a one person could be tested multiple times. In fact, I tested positive on my 6th test. I had been tested 5 other times before and tested negative. It was my 6th test that I had tested positive. So it's very difficult to put the real good statistics on just the testing rate. But I do think it's very important for us to continue to look at our hospitalization rate. When I hear numbers that are coming from Covenant and from UMC about healthcare workers who are testing positive, those are the things that I am the most concerned about. And those are the things that I think that we should be working together as a community to try to lower our hospitalization rate, lower our death count rate as well.
All right, thank you.
Okay, now we move on to Olga Aguero with El Editor.
Good afternoon, buenas tardes, and great outstanding panel, and appreciate everything that has been said, especially the real concern of the 2 CEOs in the medical field expressing truth and reality feeling of their employers, of their employees. So that's a good admiration for them. Yes, the vaccine does stop the virus, and we want to do everything possible to get everyone to get vaccinated. But yet we have those out there that, you know, are going to be resistant, and they're not going to be wanting to take it. So, and this has been thrown out there, and I just want to get the feel of y'all and see what y'all think about it. But maybe we should consider is paying people for taking the vaccine. What's your take?
Thanks, Olga. I don't know that paying people to take the vaccine is the right way to go. I think that situation would falsely influence our outcomes, and we still want to practice good science, and we don't pay people to do that sort of thing. So we just have to strongly continue to trust the science from good data sources, not anything found on Facebook or Twitter or Instagram, but go to the true websites that are publishing this data from the New England Journal of Medicine or some of our counterparts across the pond that are from Oxford University that are producing good science that back this data. That's where schools of medicine live. That's where I live in academic medicine. I have to trust the science, and I have to trust my colleagues that produce those kinds of works, not hearsay from somebody else that may have a doctorate in something else. And so just trust the science and trust good sources of data.
Okay, thank you.
Mm-hmm.
sort of like everybody talking about it, we're very concerned with the numbers of beds and deaths and everything. And yes, Lubbock was good at one time at the beginning of the virus. And yes, we would do our part encouraging people, this and that. But, it's sorry to say that, and it's sad to say, not sorry to say, but sad to say that it had to take our numbers to change in order to get, and I feel that aggressiveness now. And with that being said, Mayor, how do you feel about maybe considering such like San Antonio or El Paso or some big cities as for curfews? Do you feel that Lubbock would be eligible? And if it must be going that direction, do you see Lubbock there?
Olga, thanks for your question. We've considered a curfew. I talked to, in fact, I talked to the governor's staff about it, specifically after the El Paso ordinance had been, or curfew order had been in place for a couple of weeks. And I really, it's hard for me to see that they accomplished a lot of better results with that. I think what it does is it pushes people out of bars and restaurants into smaller gatherings in homes. I'm reluctant to do it. I think that San Antonio order was just for the weekend for Thanksgiving. I believe the El Paso order is still in place. The council will continue to talk about that, but I'm not certain that it's something that we would do that would achieve a lot of results. And I'm not just a big fan of window dressing.
Thank y'all for your time. God bless.
Thank you.
Thank you, Olga. Now we have Terry Furman with KLBK.
Good afternoon, everybody. My first question is this. The vaccine is coming, very excited about that, but just as one of you mentioned, it's going to be June, July, August before the general public sees this. I'm very glad that our healthcare workers are getting it first so that they can continue to do their jobs. How do we curb the general population from doing what we're doing? For example, Coach Beard with Texas Tech men's basketball made a video saying, no mask at the game. If you're unwilling to wear a mask, you are no longer welcome in the USA for the season. I commend him for doing that. How do we, as a population, get people to wear their masks over their noses and understand that this is a big threat? Like, my family canceled Christmas, and it's been 43 years since I've missed a Christmas with my grandmother. And that was huge. So should more people be doing that?
So I'll start and I'll let Judge Parrish, looks like he's getting ready to push the button. I think we need more people making decisions like the one your family made, Terry. My dog and my wife are very tired of me. The three of us spent Thanksgiving together. No family. Only via video conference did we connect with family. And that's unusual. We're going to have to continue to do things differently. We're all tired. The public health recommendations that are in place are not to penalize. They're a roadmap towards a quicker and safer recovery. And that's what we've got to continue to remind people and encourage people to do. Curtis?
And Terry, you were talking about Texas Tech and their response to COVID. Texas Tech, while a very big business, is still a business. And so that was a business decision that they made in order to do their part in combating COVID. And that was what they saw was their large gathering, like at the arena or at Jones Stadium, which we'll all meet together Saturday morning, and I'll be there. But Those restrictions is what Texas Tech put into place as a business. That was their business decision. The mayor talked about, and we've talked about also, businesses do have that ability. If they want to tell a patron that comes to their business, you cannot enter this business unless you are fully covered. You cannot enter this business if you cannot remain within 6 feet of our employees. If they wish to do that, they will have the full backing of the city of Lubbock and Lubbock County to enforce that. That's a decision they will have to make, just as Texas Tech made that decision. I'm glad the university took the lead on that. And I think it's very important when you have high profile folks like Coach Beard, Coach Wells, I know Dr. Skuvenik, Dr. Mitchell as well, who's also a COVID survivor, to be able to look the public in the eye and say, yes, we want to do business with you, but this is the cost that you have in doing business with us. And I think I encourage all the other businesses in Lubbock County to follow that same lead.
Okay, thank you very much. I agree. My next question is for our two CEOs of the hospitals. I know that we are looking right now with full hospitals. We are looking at more people needing beds. What is our plan? For example, a viewer sent an email saying, what about Reese Medical or the Air Force Base that has the hospital capacities and beds there? Is there any thought of encompassing Reese Air Force as far as care, or is it just the fact that we just don't have the number of caregivers to do that right now?
I'll be happy to start, Terry. This is Mark. We have actually been in conversation, Jarrett Atkinson and I have been in conversation several times about, perhaps what would the next step be? We have beds in the hospital that we're using for everything other than COVID as well. And as we start to surge into a tent or another tent or into a bus or whatever the next capacity would be, to answer your first question, it's all about staffing. You can find real estate somewhere if you have the right equipment, but staffing is everything. And if the 126 I have from the state, and I'm grateful for every one of them, if that were to be lessened or redeployed somewhere else, that is the big issue, is staffing. We, and the mayor may be able to speak more about this, but we don't want to get to the point where, of course, the federal government has to come in with their own resources and they would set up their own type of hospital situation with their own staffing. We're trying to do this with the state, in partnership with the state. So I haven't discussed Reese. We've just discussed what would happen perhaps if the federal government had to come in at some point, like they're perhaps doing elsewhere. But at this point, regardless of whether my real estate is on this campus or somewhere else, you hit the nail on the head. It's all staffing. And that's what we are most concerned about, is the availability of those folks wherever we have beds.
Agreed.
I would say the same thing from a Covenant perspective. We do actually have real estate, and we actually have real estate that'll be opening up here in the next week. As we open Grace Surgical Hospital, we have Grace Medical Center that will be vacant for the most part. But it all comes down to resources. And when you're fighting COVID, you're not doing it on the same nurse to patient ratio that you would traditional viruses. And the staff needs are way more demanding when we're dealing with this patient population. So it's not just taking our current resources, but you're going to have to expand resources significantly. And I think between the two hospitals, we have somewhere in the neighborhood of over 200 nurses from the state agency pool that's currently helping us just currently battle this virus today. So we would need way more resources than we currently have to be able to open up additional beds.
Agreed. Thank you. All right.
Sorry to cut you off there, Terry. Our next one is Karen McKay with KCBD.
Good afternoon. we've heard earlier that there are 11,000 caregivers at UMC and Covenant. And of course, there are thousands in nursing homes. And we know we're going to get some vaccines. UMC, Mark, you've said that a vaccine center is opening on December 14th. So my question is, we know we're not going to get enough vaccines in this first batch that comes. How will you prioritize who among those who need it most will get it first?
Karen, that's a great question. And in fact, that is what we're discussing this afternoon as far as prioritization, because we don't really know at this point. The pharmacy experts are telling us that what we get may not be enough initially for the full gamut of what somebody might call frontline care workers. And so how we prioritize those nurses and therapists and physicians, et cetera, that's going to be our next task, because we want to make sure whether the supply is large or small, we want to use every one of them, and we want to use it in the most effective way possible. So we're going to have a prioritization mechanism set up. It doesn't mean everybody won't get it. It just means the order in which it'll be distributed. Yes, ma'am.
And you'll divide maybe evenly between Covenant. How will you divide it between the hospitals?
Well, we're each going to get our own section. We will have our own supply. Texas Tech will have a supply. Ours will cover some of UMCP as well. And so in Covenant, we'll have their own supply. So we'll be responsible for making the best use of what we have.
Ms. Wells, can you talk to that maybe a little bit from the city, the overall community perspective, please?
Yeah, and as we get more vaccine available in the community, the health department, our pharmacies, our primary care offices are all going to be receiving their own shipments so that we can get as many community members vaccinated as quickly as possible. The more people we have, the more access points we have to vaccine, the quicker we can get that to everybody.
And Catherine, I have a question for you too. You remember the day that there were 18 deaths, which was just so terrible. And you and I talked about this, and you told me that ironically, there are only 3 of those 18 tied to nursing homes. So now overall, when you look at the whole month of November and we lost 152 people, can you explain what percentage would you say now are linked to nursing homes, or is it really a much more widespread problem than that?
I don't have the specific data on that in front of me, but we are seeing more and more individuals who are older but living at home that were exposed through family members, workplaces, being out in the community. Those are also individuals that we are seeing dying from COVID. So it's not just our nursing homes. It's a whole range of individuals that were out, really living independent lives.
Thank you.
You're on mute. Lacey, you're on mute.
Sorry. Thank you, Karen. Now we go to Don Rubio with the Daily Toreador.
Good afternoon, everyone. And I think my first question is more directed to Mayor Pope. With the end of the fall semester of college education, is there anything from the city perspective that y'all have learned in terms of managing incoming students? And are there any expected changes to how you guys will manage the incoming students coming in the spring?
Well, it's a good question. I think we learned some things in the summer. We learned they were maybe reinforced a bit in the fall. I think you see changes already being made by Texas Tech moving the start date back by not bringing students back after Thanksgiving. I think those are all positives. My understanding is that the move in, they'll do a staggered move into the dorm again in January like they did in August. I think the university has done a very good job on campus. The college age students off campus, we've had issues with certainly the positivity rate. They're more active in the community. And I think we will continue to work to share the message with them about the implications of that activity. I do think that measures that are being taken by, well, Tech basketball is a good example. You know, that's a place you see a lot of college students. Well, you'll only be able to see a quarter as many as you would have been able to see last year, and they'll be required to wear face masks. So we're seeing a number of positives happen in that regard, but I'm not sure, Don, that we can. There's much more that we'll be able to do for that population.
All right. Well, I guess really just for my last question, I think it was Mr. Thunderberg who mentioned about how Texas Tech Health Sciences Center is helping providing healthcare providers. Can you kind of go into more depth about some of the efforts in terms of how they've provided support for local health institutions?
Yes, sir, I'll be happy to. Gosh, there's a whole list of things that they have done innovatively as far as reprocessing of masks and supplies for us. That was during the early phases. And then more recently, the physicians, the intensivists, the pulmonologists that are in short supply, that are the ones taking care of the patients on the vents right now as we sit here and speak in our MICU and our CICU, et cetera. They are helping to recruit those individuals, whether it's permanent or whether it's on a locum basis. And a locum is something we're grateful for. They may be here for days and weeks, but nonetheless, they're able to pull that together. So it was Dr. Burke, the dean of the medical school, who helped to do that and made that a priority. And so we feel better about the availability of physicians in our ICUs taking care of COVID patients because of that effort and that partnership. So it's much, much appreciated.
All right, thank you.
Yes, sir.
Hey, Lacey, before we go to the next question, there was a bit of data that I failed to mention earlier that I think is important. We were talking about the hospital capacity, and we've also often talked about what's going on around the state. And early on, it was El Paso, Amarillo, and Lubbock. But I think it's important to note that the Permian Basin, the Waco area, and the Laredo area now are over 7 days, 15% or more. And I would say that our watch list includes Dallas at 5 days, over 15%, Texarkana at 4 days, Tyler Longview at 3 days, and the San Angelo area at 4 days. So it's not a panhandle, far west Texas issue. It's going on around the state. And I think that even intensifies our need to solve the problem, because we can't send our patients anywhere else, nor can we receive patients from other parts of the state or surrounding states. I wanted to drop that in. Thanks for letting me interrupt.
Thank you, Mayor. Now we go to Matthew Stell with KMAC.
Thanks, Lacey. Mayor Pope, another business, another restaurant has sadly had to close its doors. Recently, Max Barbecue on Slide said that they just couldn't survive the current conditions, and they've decided to go ahead and shut down. And I tell you, I'm sad about that, because I never got a chance to try Max Barbecue, and I love barbecue, but unfortunately, they will be shutting down soon. What is your message to small businesses here in town who are struggling, have been struggling, and are on the brink of having to close, or have already decided to close?
Well, first of all, I empathize with those that are struggling or have had to close. We've talked about that many times, and as a small business is in my DNA, so it's not hard for me to feel that way or to understand the challenges. I do know that there are better days ahead. I do know that many of our small businesses have found a way to not only improvise but to thrive, and I think that there's a number of those that have mastered takeout or mastered doing things outside, and even as it gets colder, with heaters and with coverings or ways to be creative. We've got to stay the course. We need to support our local businesses. We need to do our takeout. We need to find a way to make sure that they're there as days get better, and particularly barbecue, because, man, I'm like you. I like barbecue.
Yeah, for sure. Same. Thank you for that. Judge Parrish, for just a moment, could you clarify something for me? You
Yes,
mentioned
sir.
that our numbers are high because people are testing positive twice, or does that mean one person is because one person is testing positive twice in the week? Is that still considered a case? Just kind of clarify that point that you made earlier.
Yeah, as I pointed out, just, we've got a lot of negative testing, but there may be one individual testing negative multiple times. We have, and I know that there are some that have tested positive a couple of times because, they'll either go and get a test at one location, it'll come up positive. They believe that they may be a false positive, so they'll go to another testing place and get tested as well. That's happening. And we do know that there are different ways that some people are reporting testing, reporting positive numbers, reporting negative numbers. Catherine Wells and the folks at the City of Lubbock have done a remarkable job in trying to cull the data that's coming in from multiple different directions. But so Matthew, what I wanted to go back to though, was to remind people of the data that is truly right in front of us. And that is the number of people who have died because of COVID. We know those numbers and we can see them on a day-to-day basis. We can see the hospital capacity. We know how many people are in the hospital, how many of them have COVID, how many beds are available. Those are real numbers. And so those are the ones that I mentioned that I want for us to focus on, to make sure that we are working diligently for our hospitalization rate numbers to come down, to work diligently because of that, to make sure that our most vulnerable population, our older ones who are getting COVID, have the care that they need so they don't become a fatality statistic. Those are the numbers I want to focus on.
Gotcha. So if a person tests positive twice, they're not counted twice, or they are counted twice?
No,
yeah,
let's let Ms. Wells talk about that.
Yeah, we'll let go ahead, Kat.
Matt, we're talking about two different things. One is a case. A case is counted once if you test positive. When you're looking at a rate or a positivity rate, we're looking at the number of positive all tests and looking at the positive over all of the tests. So that one isn't deduplicated, but those case counts we put out at the end of the day are deduplicated.
Got it. Okay. Thank you.
Good clarification.
Thank you, Matthew. And finally, we have Sarah Self-Walbrick with Texas Tech Public Media.
Last but not least, all right, thank you all for being here today. I hope everyone got at least a little bit of rest over the holiday. I think both of my questions are for our hospital administrators. First, how are your facilities helping and supporting these exhausted healthcare workers' mental health?
I'll be happy to start. Or Walt, you go ahead, please.
Sure. I think from our perspective, we're doing several different things for our caregivers. We're trying to figure out ways of giving them breaks where we put in a thing called Code Lavender inside of our hospital where we actually come and create support groups for our caregivers. We do a lot of rounding from our senior leaders within our hospitals to make sure that we understand what's happening on a daily basis inside of our hospital and what we can do to fight the little battles that they're fighting, whether it's a simple supply need that they need help with, or do they need a break in this type of environment from those type of things to create some rotation pools for our caregivers so that they're not constantly fighting the same COVID virus on a daily basis. We've also done what we call comfort cart rounds. We go out and we give our caregivers, comfort measures to be able to help them get through the days. And I think it's a lot of creating open communication and awareness within our caregivers that we're here for them. I mean, all of us are in this fight together. They are definitely the front lines. They are taking the brunt of this battle. But I think it's an important thing that they know that we're here and we can do anything we can to really kind of help them get through this.
And I'll add on a couple of things to that, Sarah. One of the things we have found that really seems to resonate fairly well is just being aware of all the different moving parts and how they how they react in our system. We change things so often because you have to. Units get shut down and moved and become dedicated to COVID. Then another unit comes up and you change your rules as far as visitation, that kind of thing. So every single night we send out an update of exactly what occurred that day, what was decided that day, and that goes out to thousands of folks. We have a really active, wonderfully adept chaplain service, and we've already had our second Park and Pray. We had our second one last Saturday night, and we had hundreds of folks here just to encourage our staff from without and within. And they are here just ministering to our employees all the time. We have an incident or a stress incident center where you can call and someone can come to your department and kind of debrief or, and help folks that are going through a difficult time, especially in units that have high mortality. They really are bearing the very, very brunt of this emotionally. We've also helped our staff, when people were redeployed initially and they were using up their vacation and that kind of thing, we put in place a rescue plan so that no one was left behind financially. And so everybody got compensation regardless of who was redeployed and who was not. The last thing I'll say, those are all just measures and those are all important. And Walt would agree with this, I'm sure. We just have some exceptionally gifted administrators and directors, the director of the ER and the lab and the nurse managers who have been in charge of these units all this time. They have done an exceptionally good job, EMS, et cetera. So they've just been really very aware, even beyond me, they've been very much aware of the toll. And so they visit with their staff regularly and they take in the goodwill of the community as far as meals and prayers and that kind of thing, try to make sure it gets to the right folks in a very regular basis. So we're not doing everything. We're trying to do as much as we possibly can, listening intently and then prayerfully and deliberately trying to help as much as possible, financially, mentally, spiritually, et cetera. So it's a lot, but there's more we could do, but we're always looking for things that we can do better. So good question. Thank you, Sarah.
Sure thing. Thank you all for doing that. And of course, thank you to the thousands of healthcare workers who remain in our thoughts. The mayor just mentioned this, but many other trauma service regions are now over that 15% COVID hospitalization rate. Again, for our hospital administrators, how does that surge elsewhere affect our local facilities, especially when it comes to patient diversions and some of those resources the state has sent us, like staffing?
Well, I'll start with that just real quickly. So the staffing that comes to us from the state, as Mayor just mentioned, as Waco lights up or as Dallas begins to light up with COVID, we're going to be very tenacious in trying to keep the staff that we have here, the 126 I have and those that are at Covenant. As far as the long arms of influence that happen with COVID, there are many communities that are trying to transfer patients to us. Yesterday, we denied 29 patients. We accepted 13, but we denied 29 because they're coming from small towns, COVID or not COVID, and they're coming here because we have burn or trauma or whatever the case is, or medical services. And so we are in a bit of a balancing act every single day on who is accepted, who's denied, trying to put as many people in the system as possible. And yet those smaller hospitals are trying to find other locations. Now the state has deployed some folks through the racks to help get patients from, let's just say as an example, Denver City. If they can't come to Lubbock, they're trying to get them to Oklahoma and then perhaps Arkansas and now up to Illinois. So patients are leaving the region and going a far distance because the state is helping to get them there. And there are resources at play in that regard. But nonetheless, we are, as you said, we're denying and accepting every day. And we are worried, concerned about the ability to get those staff you're speaking of in the state, should something in Dallas light up where those staff would perhaps not be quite as available. And I'll kick it over to Walt.
Yeah, I would just add on to that. What we're seeing is a blanket spread of this virus, and it's affecting a lot of different hospitals. And when you talk about our region, in the past has been listed as one of the top 10 in the United States as far as bed capacity and ICU capacity specifically, in ratio to the number of patient population that we have. But we're fighting this not just for our region, we're fighting this for a lot of other regions. I mean, just within this last 2 days, we've had a transfer try to come to us from Colorado, 1 from Kansas, and 3 from Oklahoma. Not counting all the patients we constantly get from New Mexico, because we take care of everybody. That's our responsibility. If you're sick, that's what healthcare is here for, to take care of you. But we're all fighting this thing together, and as much as spread as we're seeing throughout this, it's becoming a burden not just in our community, but on all communities. It is a big concern to us from a resource standpoint. When we talk about the spread that's happening in the Dallas-Fort Worth area and in some of the other areas, we're really fighting a situation of, are these resources still going to be available to us from a state perspective? And if they're not, then what's our plan going to be? Because the patients aren't going to stop coming. We have to have a plan to figure out some other resource options as well.
Thank you all again for being here. Take care.
Okay, thank you. That concludes today's news conference. That was a long one, but thank you all for joining us, and thank you so much to our panelists and our interpreter. Daily COVID information can be found on the city's social accounts and at mylubbock.us/COVID.